Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. We're joined today by Vanessa Becker, who's heading the modernization efforts for public health over at DPHN, and we'll talk with her later. But as always, we'll start with things COVID. So if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we will get to those questions. We have one question today that we'll spend some time answering. So the news on COVID is almost all good. This is so heartening to me. You know, we really had quite the tough time over the last few years, but the news now is pretty good. Almost every place in the world, the number of cases is declining. We're still seeing a little bit of activity in Asia, but for the most part, the rest of the world is quiet, and we're not seeing any new hotspots. Also in the world, we're not seeing any new variants. So this is really the first time in the pandemic where we've had a low amount of disease, a declining amount of disease, and no new variants on the horizon. So the good news is COVID is doing very well right now. In the U.S., cases, hospitalizations, and deaths are declining. There's still a little bit of heat in the interior Midwest, interior Southeast. So Kentucky, Mississippi, Tennessee have had more than their share of cases, but the rest of the country is pretty quiet. Oregon is pretty quiet. Douglas County is pretty quiet. We're seeing fewer and fewer cases each week and fewer hospitalizations, although we have continued to have some deaths. And the things about the hospitalization and death is almost all of them are in people who are not vaccinated and have never had the disease. So people have had the disease before, built up some immunity. People had the vaccine, have built up some immunity. And people have had both the disease and the vaccine have built up a lot of immunity, and they rarely get hospitalized and almost never die. But in those people who've never had the disease before and they've never been vaccinated, boy, they're really bearing the brunt of the disease at this point. So this is really a plea to anyone who early on decided they didn't want to get the vaccine to go ahead and do it. We now have over a year's worth of data on the early recipients of the vaccine. There do not seem to be any early or late complications. The only complication with the vaccine was this rare myocarditis, which seems to be really quite rare and much less than if you get the disease. And there were some troubles with clotting with J&J, but we're not using that anymore. So with the vaccines that we have now, the Pfizer and the Moderna are both very safe and very effective. And again, we would really like someday to declare that this is the last death from COVID. The other good news that's on the horizon is the bivalent COVID vaccine. So most of the COVID vaccines until now have been a monovalent vaccine, which means they have one version of the germ, and the version of the germ is from the earliest time back in January of 2020. And since then, as we know, this virus has mutated many times. And as the virus mutates many times, the vaccine gets less and less and less effective. This new booster has both the original strain and the new Omicron strain. And so with the original strain and the new Omicron strain, it should boost your immunity and give you immunity to the Omicron. The full data is not out yet, but it appears to be very safe and very effective. And it should be available within the next week. The FDA approved it yesterday. We have an order in for 2,000 doses of the vaccine, and we should be getting those soon. So our hope is that everybody 12 and above gets a booster. And I think if everybody 12 and above got a booster and there was no development of a new scary variant, we could almost be done with this. And boy, I would really like almost to be done with COVID. So a friend asked a question today about it sounds like people are getting this again and again. And it indeed is true. What we're seeing is that people who've not been vaccinated sometimes have had the disease 3 and 4 times. What's that about? Even people who've been vaccinated are now getting cases. But what we're seeing is in people who either had prior illness or had the vaccine, when they get it, they tend not to get super sick. Now, sick, staying home, feeling miserable, but not being hospitalized and not dying from it. It's those people who've never had experience, neither vaccinated nor a history of the disease, that it really seems to be bearing the brunt of hospitalizations and deaths. And so why do we keep getting this? Well, it's because it's an RNA respiratory virus. So there are some viruses that you get once, you never get it again. So measles, it is so rare to have a second case of measles. Smallpox, if you had smallpox, you're not going to get it again because you have really such good immunity. But with the respiratory viruses, especially the RNA respiratory virus, you get them again and again. And that's why, you keep getting colds because you can get the same virus again and again. So coronavirus in its previous forms caused the common cold. And so when you swab people who had a common cold, coronavirus accounted for maybe 30% of the colds out there. And you get coronavirus and then you get it again 2 years later and then again 3 years later. So it's the kind of thing which you can get again and again. And in fact, when they looked at before COVID came out, they looked at people who had coronavirus and had good antibodies to it. And then they looked the next year what happened. And what happened the next year is they got coronavirus again. So I think the reality with coronaviruses is that they do change, and our body's immunity does not stay high for a long time. So I think what's going to happen is we're going to have a yearly booster for COVID, just like we have a yearly booster for the flu. Again, flu changes a little bit and your immunity wanes. So you really need to get a flu shot every year. And I think you're going to really need to get a COVID shot every year. And while that would be a little miserable, it's certainly not the end of the world. I mean, the vaccines work well, relatively low side effects. And so we're recommending that people do that. For next week, somebody asked a question about our doppelganger communities. So as you remember that early on, we compared Douglas County to 3 other counties around the country that had very similar demographics. And next week, we'll show how each of those counties and how other selected counties did with COVID. There are 2 other pieces of news in infectious disease in the community. One is monkeypox. There is no monkeypox yet in Douglas County. There continue to be cases in the rest of the country. Oregon's had a little over 100 cases, none yet in Douglas County. Again, most of the cases now are in a group of men, especially men who've had sex with men, and then the people they've had close contact with. So sometimes other people in the family situation, and there have been a few pediatric cases that have come when one of the adults in the situations had it. The good news is not a particularly serious disease, so there have been no deaths in the U.S. associated with monkeypox, but it can be really quite painful and disfiguring and really not very nice. So we're really looking not to have this established in our community, and so we're tracking down each of the cases when they're found. We do have a vaccine which can prevent the disease if you get the vaccine before you're exposed. It can even prevent disease after you've been exposed. So we're really hoping that we can get rid of monkeypox so it's out of our society. Monkeypox was in the U.S. back in 2003, and at that time it was among people who cared for pet prairie dogs. Who knows? So people who there were animals imported from Africa. They hung around with some prairie dogs in a pet store. The prairie dogs got it and then gave it to people. We were able to control that outbreak because it was just among prairie dog owners, and thank God there are not very many of those. And we were able then to go ahead and control this outbreak. We're hoping this time we can control the outbreak, because this would be a terrible disease to have to kind of worry about all the time. You could imagine somebody on a wrestling team got it. Ugh, what a mess that would be for the other members of the wrestling team. So monkeypox, the cases are going down. The vaccine is there. We have plenty of vaccines. So if you're in a high-risk group, that is men have sex with men, or know somebody else who has it, please, please, please give us a call, and we can get you a vaccine. The last piece of news is E. coli. In the summertime, E. coli is one of the things we worry about. E. coli is mostly an animal-borne disease that then humans pick up. And when they get it, they can get pretty sick with diarrhea, some bloody diarrhea. And in the worst cases, a toxin can get in the bloodstream, and they can have troubles with breakdown of their blood cells and kidney trouble. So it's a worry. We've seen a couple of cases this summer. Usually it's associated with livestock contact. And so there are a bunch of germs that animals carry, and they're not very sick with them. But when humans then come in contact, they get it. So I can remember the story of a kid I cared for who was very ill. He had a bone infection. And we figured it out, it was a salmonella bone infection. And the question is, where in the world did you pick up this salmonella? It turned out that he had a pet duck, and he used to take baths with pet duck and drink the water. And so he had exposure to the duck's feces. Ducks carry salmonella and they're not very sick with it. But obviously, when humans get it, they can get quite sick. So we really need to be careful about exposures, especially to birds, which tend to carry salmonella, reptiles, which also can carry salmonella, and then livestock, which could carry this E. coli. And so the recommendation is after you're in contact with the feces from livestock, you need to wash your hands. I think your grandmother told you that, and your mom told you that when you were a kid, but it really is good advice. And for always good advice, we have Vanessa Becker with us today. Vanessa is one of our epidemiologists. If you have been pleased with some of the great communications, how we've done some of our great infographics, this session today, the weekly reports of that, you have not me to thank, you have Vanessa to thank. She gets up at the crack of dawn every day with her rooster and prepares these reports so that these reports are available. So if you're interested in what's happening, she posts these reports every Wednesday. But that's not all she does. In addition to that, she's the head of our modernization program. So Vanessa, thank you for joining us.
Yes, thank you. Thank you for the warm welcome.
Well, you are great. Someday over drink, we'll tell people about how it was you got hired for this job. It was, I think we think it's the world's fastest hire. But anyway, you've been a great help for our COVID efforts. And now you're doing modernization. So can you, in a minute or two, explain what modernization is all about?
Yeah, so in around 2013-14, the state of Oregon changed how and transformed how funding for public health happens, and they started using the word modernization, and so that's the word we use about this public health effort. It's still based on the core principles of everything that public health does and focuses on things like communicable diseases, things like community education, looking at how do we prepare ourselves for all hazards, things like wildfires and smoke. So it's still based on the core principles of what we've been doing, but it's looking at how can we partner with other organizations and community groups and community members to expand and improve access to all of those public health services and things that we do. So an example of one of the projects that we're focusing on at DPHN in our modernization work is we're going to hear more about probably next week. But it's a emergency preparedness packet and kit specifically for seniors. And this is a partnership that the Douglas Public Health Network has with our modernization funds, with the county senior services, with OHSU, and with Office of Rural Health. And so we're putting together very specific senior emergency preparedness kits and materials. And then we'll be working with senior services to get those out at meal sites, our senior dining sites, as well as meals with the Meals on Wheels program. So again, it's the same. It's a similar program we've been doing for a long time around emergency preparedness, but this time with the modernization effort, it's really collaborative and really trying to get as much sort of bang for our buck, as we say.
Yeah, and I think that's great. So that's a great teaser for next week. We're hoping to have somebody from Senior Services join us to talk about this program. What most people do not recognize is that when a disaster hits, the death toll is not evenly distributed among the population. So seniors only make up about 1/8 of the population, yet in Katrina or the Paradise Fire and other big disasters, they make up half of the fatalities. So people over 70 really are at risk. They have decreased mobility. They may not have cars, or they may not be driving. They may have medical equipment they need to bring with them, or they may be really in love with their pets and don't want to leave them. So these are all things we're looking at. And so the modernization effort, I think, really is going to be great because it's going to focus on the especially vulnerable populations. And certainly for emergencies in most places, it's going to be the seniors. So that's a great tease. Well, Vanessa, thanks so much for joining us. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. We'll do this again next week. Again, if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. Thanks.